Hello, we will talk about how to use BNF. But before coming to the details about the BNF, we would like to have a brief discussion about some basics to be aware about. Firstly, regarding the prescribing guidance, we are not only depending on the BNF when we are prescribing medications for patients. Sometimes we will depend on local hospital protocols we are having in our hospital setting. Sometimes we will follow national guidelines, like for example, NICE guidelines or RCOG guidelines, RCS guidelines, whatever is it. So regarding the BNF, it is one of the tools of prescribing medications, but it is not the only tool. We are having two types of BNF, one for adult and one for children, and both are updated every year. And in this one, we will need to be familiar with it, as in some exams like PLAB 2 exam, one of the skills that you need to be aware about how to deal with the BNF, either the adult one or the pediatric one. And both are named to differentiate between them, both are named and both are having different colors. You can see this is BNF for adult or this is BNF for children. And the common color for adult BNF is this yellow one. And the common color for the pediatric BNF is pink one. Sometimes also could be blue. All right. And we will talk together about how to use this BNF and try to ensure that you are dealing with the right one. You are picking the adult one or you are picking the pediatric one. Simply, when we need to deal with the BNF, as I told you, we are having adult one and we are having pediatric one. And there is also soft copy of this BNF, which is belonging to the NICE guidelines. You can search about it on Google. You can Google it at any time if you need to check any details regarding the medications. And to make things easy, when you deal with the BNF, you can, the most updated one right now is 86. All right, as I told you, every year they are updating it to add some changes. The first thing when you deal with the BNF, this is the BNF lock when you are closing it. You need to know that we are dealing with two groups of papers. The first and the common group is called index. And you can open on this index directly. It is the last black colored papers here. I hope it is clear for you. Just when I need to open directly, I need just to open this. Sometimes it could be having also some different color to be easy to pick it when the BNF is closed. So we are having two main groups. One is called index and one is called appendix. This is appendix, this is index. And you can see that this is appendix also is categorized into two groups, appendix 1 and appendix 2. No need to know about the differences between them right now. So I'd like you to know when the BNF is closed right now that we are having two groups of paper to deal with them. The first, which are the last black one, index. The second are appendix. So what is the difference between index and what is the difference between index and appendix? Regarding index, you can see in it the name of the whole possible medications which are categorized alphabetically from A to Z, A, B, C, D, E. Okay, right? And also is having names of topics for different conditions categorized alphabetically. Like for example, you can find the topic with urinary tract infection management, or you can find the topic with DVT management, or you can find topic with diabetic foot management. So also the name of these conditions are categorized under the same alphabetical order. So when you are opening the A letter in the index, you will not find only medications, but also you will find name of topics started with A letter, and what are the management plans of these topics, and what are the alternative options in cases of allergies or contraindications. So this is the index one, name of medications and name of topics, and both are categorized alphabetically from A to Z. The appendix also is categorized alphabetically from A to Z, but the difference between the index and the appendix, that in the index, usually the categorization is by the family name of the medications rather than the medication name itself. In the index, no. The categorization is by the drug names, not the family name of the drug. Let's give an example for this. If you want to search about erythromycin in the index, you can open for E letter, so this is E, erythro ER, for example, ER, erythro, ERY, erythromycin, 587. So this is erythromycin. If you want to search about erythromycin in appendix, you will not find it named erythromycin. You will find it under macrolide categories. Under macrolide categories. So this is the difference between the index and the appendix. But this is not general rule. Macrolide, you will find it under macrolide. Erythromycin under macrolide. You will not find the name of erythromycin in this uppermost blue area. So this is the difference between the index and the appendix. But there is definitely some exceptions regarding the appendix, that sometimes you can find some medications named by the name itself, not by the category of the family name of the medication. All right? All right. When we need to search about drug to know about its dose, its indication, sometimes also the duration of treatment, we are starting by searching in index. But when you need to know, is there any interaction between this medication and other medication, we are opening the appendix. We are opening what? We are opening the appendix. And if you didn't find any named interaction regarding the medications that you are searching about, and the other one which is prescribed, which was prescribed with this medication, this means that there is no interaction simply. All right? All right. So if you need to search about interaction, you will go for appendix. If you need to search about the medication to know where this exactly is the page of this medication and what's the indications and the durations, you will go for index. So usually we will start from using the index. One more thing. How to know alternatives? How can I know in case of allergy the alternative is that? To know the alternative in case of allergy or in case of contraindication, simply go to the topic name of the condition. Like, for example, if you want to know the line of management of urinary tract infection, you will open for the U section in the index, U. All right, now U. I will go for urinary tract infection. U. 641. I will go for 641. 641 641 I will check right now here urinary tract infection, and here are the drug treatment of the urinary tract infection and the choices of the medications. The first line is, the second line if no improvement is, in case of pregnancy is. So here are the choices. So I can find different choices under the topic name. All right? Under the topic name I can find different choices. And under the medication name itself you will find the whole details about this. All right? I hope this point is crystal clear. And we can follow the same rule in the pediatric BNF. You are having index and you are having appendix. So this is the index, is the last black, and this is the appendix 1. And as I told you, in the appendix we are searching for interactions, but in the index we are searching for the medication name or the condition name, which are both categorized alphabetically to know what are possible choices and what are the details. Thank you.